My name is Roderick Bailey. I'm a historian at the University of Oxford, where I work mainly on the histories of global health and epidemic disease. I also work on the history of war and conflict and the modern history of Southern Europe. And the object that I'm going to talk about, and that you'll see in front of you, relates to each of these subjects. That is the histories of medicine and disease, the history of war, and the history of Greece. But I also feel it's an item that can speak also to the global crisis, the COVID-19 pandemic, that Greece, like every other country, is living through today. As you can see, it's a photograph. It comes from the archives of London's Imperial War Museum, and it was taken in Athens in a health clinic in the closing months of the Second World War. In fact, we can be even more exact about the date. Attached to the back of the photograph is a note telling us that it was taken on the 27th of February 1945. The note also tells us that a British soldier took the picture. And what it shows, as you may have spotted, is a Greek health worker in crisp white uniform filling a syringe with vaccine. In her right hand she holds the syringe, in her left the phial of vaccine. Unfortunately, the photo doesn't tell us her name, so I can't tell you who she is. But we do know the identity of the photographer. His name was Reginald Morris. He came from North London, and when he took this image, he was 26 years old. Both before and after the war, Morris worked in film and television as a camera operator and cameraman. He was also the younger brother of the famous cinematographer Ozzie Morris, who would win an Oscar for his work on the movie Fiddler on the Roof. But when this photo was taken, the younger Morris, Reginald Morris, was an official British Army war photographer. And at that moment, he was attached to British forces that had entered Greece on the heels of the German withdrawal in late 1944, after Greece had endured 3.5 years of Axis occupation. But this was still a time of extreme crisis in Greece, a time of violent tension between the established order and Greeks who wished to take the country in a different political direction. In recent weeks, in fact, Morris had taken some now iconic photographs of street fighting in Athens between Greek government forces, backed by British soldiers on one side, and communist-led Greek fighters on the other. By February 1945, though, when the photograph was taken, that fighting had died away, and Morris was photographing new subjects. This is one of them, and it shows a different kind of battle, the fight in Athens to control the spread of infectious disease. Specifically, this was a battle to control typhus. Typhus is a bacterial disease typically spread by human body lice or by mites or by fleas. It's also especially common in times of war and natural disaster, being closely associated with overcrowded human populations and conditions of poor health and poor hygiene. And in 1945, Athens, a war zone filled with thousands of refugees, seemed a perfect setting for an epidemic to take hold. Already, in fact, cases of typhus were breaking out, and a fear of an impending epidemic had even seen all sides in Greece's civil conflict come together to agree to support a planned programme to stop those cases spreading. This was a programme devised by a Texas-born Greek-American, Chris Zarafonitis, who was attached as a US Army typhus specialist to the British forces then in Greece. The plan comprised measures like contact tracing and quarantine, measures that we're very familiar with today, plus the liberal use of pesticides to kill insects in people's clothes, and, as we can see here, vaccines. It was also an effective programme. In the end, no major epidemic developed. Now, for me, this image underlines the timelessness of humanity's efforts to preserve its health from infectious disease. The natural world has long been able to remind us of how delicate is our place within it, and how fragile our lives and well-being can feel, and how insignificant our differences and disagreements can seem, when confronted with the power of pathogens. And it also remains the case, of course, that humanity's own actions create conditions in which pathogens thrive. But this is also an image of international cooperation. Here we have a Greek health worker holding a phial of what was probably an American-made vaccine, which he's preparing as part of a disease control program designed by an American who is working in Greece with British forces. It's a snapshot too of a result of decades of disease research into typhus, into ways to control it, and into vaccines. And lastly, it's an image that reminds us as well to think of the healthcare workers who are trained, willing, and able to administer vaccines and respond in so many other ways to the threat and reality of infectious disease.